So as the leader of Telehealth's global business, I get to see how virtual care is making better health happen in big cities, small towns, in rural communities, all around the world. Not just the US, but really all around the world. Just yesterday, we had here Joanne Pelly, who talked about how virtual care is increasing and relieving the pressure of providers in the remote Newfoundland and Labrador in regions of Canada. Our next speaker brings this to an even broader global perspective. As a co-founder and CEO of the World Telehealth Initiative, Sharon Allen helps provide quality healthcare to people who need it most around the world. Over the years, Telehealth has been supporting the WTI by donating our technology to them. And many providers and some of the health systems in this room have been donating their time and expertise to help as well. We are very proud to support this life-changing work, and I'm very thrilled to welcome Sharon to Forum to share her experiences with you. So please join me in welcoming Sharon Allen.
Good afternoon, everyone. I'm so excited to be here because today we believe in the power of technology to improve health. But let's be honest, it's a heavy time in global healthcare. Funding cuts, political divides, wars, and disasters can make us feel like we're falling behind. And yet, this is exactly the moment the World Telehealth Initiative, or WTI, can offer a beacon of hope. WTI's mission is simple yet powerful. We deliver sustainable medical expertise to vulnerable communities to upskill the local clinicians and build the capacity of their health systems, thereby advancing healthcare for thousands of people. This is done through a core of volunteer healthcare professionals supported by advanced telehealth technology provided by Teladoc Health. Over the past 8 years, we've learned that true sustainable change happens when clinicians are empowered to lead with the right tools, the right knowledge, and the right partnerships. Let me share what this looks like. In Africa and Southeast Asia's diagnostic deserts, local clinicians struggled to diagnose pneumonia and internal bleeding and many other conditions because they didn't have imaging. But in partnership with Orlando Health, Butterfly Networks, and using Teladoc's virtual care devices, we equipped and trained these in-country clinicians on the use of butterfly ultrasounds. Now, these clinicians produce clear, readable images, leading to accurate diagnostics and saving lives daily. In Haiti, maternal mortality was tragically common, primarily due to undiagnosed peripartum cardiomyopathy, which is a swelling and weakening of the heart in pregnant women or those that had just delivered. But due to the current instability of the country, in-person training and support are not possible, so these vulnerable women were left essentially abandoned. However, cardiologists from Yale, using virtual care, partnered with the on-site clinicians to identify and treat these mothers. These are women that now get to go home and raise their babies. In Togo, newborns were spiking fevers and dying without cause or clarity. Through WTI's virtual consults, local clinicians now receive expert guidance on prevention protocols and treatment consultations in real time. For further insight, I'll share a brief video highlighting our program in Kenya.
World Telehealth Initiative has a long-standing partnership with the Longiza County Referral Hospital in Kenya. We support healthcare providers at the hospital with caring for their community via telehealth. Our network of volunteer medical specialists from around the world collaborate with clinicians in Longiza to support patients who need specialized care.
Our experience has been amazing. It has been of great help as a general practitioner. It has come in really handy in terms of managing our patients. The lack of specialists in our region, and I'll not say this just isolated to Longisa, it's the whole country. We use general practitioners to do from casualty critical care all the way to the theater, and that has been a strain. But luckily, we are now exposed to these other well-trained consultants who have specialized in different fields, and they're able to guide us. And we've been able to see real improvement in terms of service delivery for us. It has actually built in us a wide world. It's making our world truly a global village.
It's a good thing. You can get to relate with other doctors from abroad who can take you through questions, management, and even exams. Get to expand our knowledge, get to know how to manage our patients better. So it's a good thing. I love it.
We've seen this model work in every context. In conflict zones like Ukraine, where crossing a border for a medical consultation is impossible, telehealth has opened access to care. In places where there's only one doctor serving tens of thousands of patients, we've connected that doctor to a world of expertise, turning that isolation into collaboration. In health systems with little training opportunities, we've turned bedside care into an active classroom, so upskilling those providers while the patients are receiving quality care. Virtual care is not a compromise, it's a catalyst. It accelerates diagnoses, expands reach, and builds the local capacity without displacing the local leadership. Just imagine what's possible if we scale this model together. Today, with 1,700 providers and 50 programs, we've proven what's possible, but really we've only just begun. Imagine a world where every clinician anywhere has a lifeline to expertise, where maternal deaths are preventable, not inevitable, and where diagnostic deserts are replaced by diagnostic access. This isn't a dream, it's a clear, sustainable pathway that we can walk together. With your partnership, we could grow to 170,000 providers and 5,000 programs and beyond, reaching every community that needs us. In a world fractured by conflict, climate crises, political divides, healthcare can be that bridge. When a doctor in Togo connects with the neonatologist in Santa Barbara, the borders disappear. When a nurse in Haiti is mentored by a cardiologist in New Haven, divisions dissolve. Health equity is not just a health goal, it's a driver of global stability. Let me leave you with one more story. A couple months ago, 5-year-old Amira had lost 2 siblings due to measles. Yet she arrived at the local hospital, her body ravaged with a high fever, the classic body rash, and relentless seizures. Local doctors were desperate. Fortunately, through MyWTI, they were connected to a pediatric specialist, this one from Spain, and he guided the local care team through an advanced care protocol. 5 days later, Amira opened her eyes, and soon after, she went home with her mother. This is what happens when technology meets the compassion of the humanitarian health workforce around the world. As we close, I invite each of you to see yourself in this movement, whether as a single provider, an entire health system of providers, a donor, a technology partner, or an advocate. You can help transform healthcare for the vulnerable communities throughout the world. Together, we can bring the world closer, using the technology we believe in to create the future we all need. Thank you.